we'd like to introduce Mr. Anthony Russo, who is going to tell us from his own first patient experience what it was like to be in an ICU.
Thank you. Thank you very much. I'm not used to speaking in front of big rooms of people, so forgive me if I'm a little slow or nervous. My name's Anthony Russo. I'm not a doctor. I'm not in the medical profession. I'm a real estate developer. I'm here this morning with my wife, Deborah, and I've been asked to talk about our own story, basically, our experience in an ICU. The first thing I want to do before I talk about that, though, is I need to say some thanks. I really want to thank Mary Ann and Dr. Wes Ely and Michelle Ballas, the folks that have really taken this idea of trying to keep people from being completely sedated. It's an incredible effort, and I keep telling them they need to be on 60 Minutes someday because this is extremely, extremely important. And I also want to thank my wife and my family, and I'll tell you why in a minute. And I really want to extend a thanks to the doctors and nurses and technicians and janitors and everyone at Sutter Solano Medical Center in Vallejo, which is about 40 minutes from here, for saving my life. I never get sick, except I've got a cold today. In the fall of 2009, so I'll always sort of start with this part of it. I was driving back to my office and I was listening to a radio talk show, and they were talking about the upcoming flu season. And they were talking about this virus. And I couldn't turn it off. I drove into my parking lot, I stopped the car, I remember exactly what parking space I was sitting in, and I was listening to this and I thought, damn it, I'm going to get this stupid thing and it's going to kill me. And 2 months later it almost did. In December of 2009, I got the flu. December the 4th, to be exact. It was on a Thursday. The following Monday, still wasn't feeling very well and went to our doctor, whose office was packed with sick people. And a new doctor saw me for about 5 minutes and said, "You have a little touch of bronchitis. I'm going to give you an inhaler and some medication. Go home and you'll feel better." Well, I had bronchitis as a kid. I know what it's like. You feel like dirt for a week and then you start to feel a little better. But I didn't feel better. The next day, my wife, who'd been sick, went to work. I still stayed home. By the time she came home that night at 5 p.m., I couldn't get off the couch. I couldn't breathe. I had a fever. I couldn't think. And she said, "Let's go to the hospital." And I said, "Let's go." She says, "Let's go." And I said, "No, I can't go. We got to call an ambulance." And the ambulance finally came and gave us a choice of 2 hospitals because we don't really go to our doctors are not in the area. And we chose to go to Sutter Vallejo. And I think that choice saved my life. When we finally got there that evening, the doctor who examined me said, "You have pneumonia, a touch of pneumonia in both lungs. We're going to give you some IV, some antibiotics, and then we'll send you home." My wife, right before I was going to be discharged a few hours later, asked the nurse to check my pulse ox. I don't know what a pulse ox is. My wife doesn't know what a pulse ox is. But she asked that it be checked. And I remember it reading in the low to mid 90s when I checked in. When they checked it right before I was ready to leave, it was 86. The nurse says, "You're not going anywhere. We're going to keep you overnight." So they told my wife to go home, get some rest, because she wasn't feeling well still. They would get me in a room. They'd call her the next morning to come pick me up. They were so busy that by about 2 a.m., they put me in an isolation room. And almost immediately when they left me, I really couldn't breathe. I mean, I was struggling. And I called the nurse, and the respiratory therapist. I buzzed and buzzed and buzzed. And I think they were just afraid. I don't think they really knew at that time what they were dealing with. And finally, the respiratory therapist came in and said, you got to relax. You're going to be fine. Breathe in through your mouth, out, or breathe in through your nose, out through your mouth, and, we'll take care of you. Well, I sat there trying to do that, or laid there trying to do that, and I couldn't. I literally thought I was going to die. I tried to pick up the phone to call my wife. I knocked it over on the floor. About 6 a.m. when the shift changed, another nurse named Jill took over, and she told my wife later, she normally has a choice of either seeing the folks in isolation last or first. And this morning she chose to see me first. I remember clearly her walking into the room. She went over to the curtains, she opened them because it was now morning. She took one look at me and she said, "Oh my God," and she hit the button, and everybody came. And the doctor who did come in, said, "We're going to have to sedate you, and we're going to have to put a tube in to help you breathe. And I need you to sign a form." And if that form would have said, "I'm going to shoot you and put you out of your misery," I would have signed that too, because it was that bad. Jill, the nurse, said, "I need to call your wife. What do you want me to tell her?" I said, "Tell her that I love her." And that's the last thing I remember for 22 days. My wife, who was at home, who got a call, thinking she was going to come to pick me up, got a call from the nurse who said, "Do you have your children near you? I'd suggest that you get them here." And Deborah said, "Is he going to be all right?" And Jill said, "We don't know." We lived about 15 minutes from the hospital, and Deborah came, and they had done the intubation in my room and took me to ICU. I was diagnosed, I think, 17 straight days with H1N1. On 2 or 3 occasions, they told Deborah I probably wouldn't live through the night. At one point, the doctor went to her and said, "We've done about all we can do. It's up to him now." But I did survive through the incredible work of Dr. Michael Liu and all of the nurses and respiratory therapists, and everyone who, half of them I don't even remember, who worked tirelessly to save me. And my family, my wife stayed during the day with my daughter, and my son quit his job in Los Angeles and moved up and stayed with me during the nights to make sure that I had the care that I needed. And fortunate for me, I had those advocates to help me. A lot of people don't. And I can't tell you how important it is for a patient who's in that condition to have their family or have somebody around to be there all the time. Dr. Liu showed my son how to read the screens and gave him his cell phone number and said, "If these screens start doing this, you call me." One night he had to. Eventually, the first thing I remember of this world was waking up on New Year's morning, December 31st. Deborah was sitting beside me, and we were watching the news. And it had been so cold that winter that that's all they were talking about. That's 22 days. For 22 days, my body lied in that bed. But for me, for those 22 days, my life was sheer terror. I can clearly recall over 20 separate, I call them nightmares now, that occurred throughout that time. And it was so strange because in almost all of them, I knew I was sick in a hospital bed, but it was really irrelevant. I watched my daughter die 4 times, my son twice. I was in Boston Harbor at the turn of the century getting off a boat with a bunch of sick people who wouldn't get let into the city, and eventually we were burned. In one, I had recovered enough, but my family couldn't pay the medical bills, and we had to sell our daughter to sex slaves. And I watched her get on a pirate ship in Southern California in the middle of 2010. These are so bizarre, they're hard to explain. And to look at intelligent people and try to tell them that these were so real that they actually, in my mind, they actually happened. I had one where my wife and mother-in-law had moved to a Swiss chalet in Solano County. And the only way you could get to the Swiss chalet was on a little steam engine like you see in an amusement park. And I had recovered enough to go there, but they stuck me in an apartment about halfway up, and that's where they imprisoned me there. And on the day I went home from the hospital, I went straight out of the ICU home, because we weren't going to go anywhere else where I could get sick anymore. My wife said later, she said, "I remember looking at you. You looked like you were a deer in the headlights." Well, I thought I was going to that place. I literally thought that's where we were going to go. And when we drove up to our regular house, and I got wheeled in because not only was I sedated for 22 days, I was paralyzed. Because every time I would move, I think the fluid would recirculate in my body and I'd start to drown. So when I went home in that wheelchair and they took me to my real house, it took me weeks before I stopped thinking, this is just a game. They're now going to take me to that place. These nightmares are so real, they would appear to me out of the blue any time of the day. And they blocked out the sun. They consumed me for, well, it's only been a few months since they pretty much started to go away. I would get panic attacks. I eventually went back to work and would be sitting at my desk, and one of these visions would just appear. My office would be gone, and I would be right in it again. It took 2 years before I could look at my daughter without seeing her brain splattered across the floor, because in one of those nightmares, that's what happened to her. It took 2 years for me to get physically back to normal. I had to learn to basically move and walk again. I still have a little trouble writing. No one can read my handwriting. I still have a little bit of trouble when I try to compose email or write. Things get mixed up. But those are minor problems compared to the emotional problems that I've struggled with. And it wasn't until 2012 when, through sheer luck, I think, we were introduced to Mary Ann, who was doing a study about ICU dementia and ICU delirium. And it wasn't until then that I realized what I had. Because up until that point, I just thought I was going crazy. And for all of when you go through a life experience like I did, and you come out the other side, everybody wants you to now, and you should smell the roses, you should enjoy it. You have been given a great gift. And I have been given a great gift. I've had 4 anniversaries with my wife. I've had 8 more birthdays with my kids. I wouldn't trade them for anything in the world. But I can clearly tell you there were many times when I just wanted to give up and say it really wasn't worth it. Because life was not worth living. It was miserable. And I couldn't understand what was happening to me. And the day that I met Mary Ann, the day that we met her, and the day that we understood what was going on here, was really the first day of my ICU liberation. Because for me, understanding what was happening to me was the first step to being able to deal with it. And I've had a lot of help from my family. I've had a lot of help from professionals. When these nightmares appear, which they don't much anymore, but when they did, I learned to basically sit with them and to go through them and to live them every time they came, so that they would eventually not have much power over me. And it actually worked. I'm getting better. I think I'm going to make it. But it's taken 4 years. And through this adventure with Marianne and Wes and Michelle and others, I've been able to talk to a handful of people who've suffered similar experiences to me. And it's a very small sample size, but almost everyone has similar experiences, crazy dreams, crazy thoughts that are very real to them. And it wasn't until the psychologist said to me, Anthony, for 22 days your body lied in that hospital bed, but for 22 days what you lived was those nightmares. And it's no different than, what he said was, it's no different than a soldier in Iraq or Iran. Well, to me, yeah, it was a big difference. They lived through that. Those experiences that caused them their post-traumatic stress syndrome, those were real. Mine were fake. And it wasn't until he made me understand, to me, those were as real to me as those were to them. Because I thought for the longest time, how in the world can you compare me to those people who went through what they did? All I was doing was lying in a hospital bed. The one thing that I think would have helped tremendously, and I don't think people understood it at the time, was when I came to, when I was awake, and I was still sort of hallucinating off and on, if someone would have come into the room, shut the door, sat down at the bed next to me and said, okay, your body's been there for 21 days and here's what we've done, but I need you to tell me where you've been. What have you experienced? Where did you go? What did you see? I think that might have made a tremendous difference for me, because I think at that time I would have known that somebody understood what was going on. Because for the longest time I didn't want to tell anybody anything, because I think they would have thought I was crazy too. And it took a long time for me to be able to understand that, these were things that needed to be talked about and they were needed to be dealt with. To this day, there's still three of these nightmares, I guess I'll say, that I can't talk about. And maybe someday I can, and then I can finally rid myself of them. But for patients in the future, for the guidelines that you're going to go through today, I can't tell you, I would have never been able to have been woken up. I was at such a stage where, they did what they had to do to save my life. And again, I do want to say I'm eternally grateful for that. But the things that are happening now are so important. I do think Marianne and her crew need to be on 60 Minutes someday. The world needs to know about this. But for those patients who can't be woken up, who can't be in an ICU without being sedated, when they come to, they're going to need a lot of care. And one of the things I hope happens in the future is that there's a website for those folks so that they can see what they have had happen to them and kind of know what's in store for them. It's, I think, incredibly important. And with that, I think that's our story, and I'd certainly be willing to take any questions now or later. Thank you.
What a brave and moving testimony. So we will take questions for Anthony now, if you want. That's okay. Dr. Julie Barr, would you like to ask the first question?
Good morning, Anthony. It's nice to see you again. Thank you for sharing that very intimate, poignant, and painful account of what you went through. I'm hoping that you can describe for us some of the cognitive problems that you've had. You spoke at length about the nightmarish recollections of your delirium in the ICU. Can you speak to the cognitive issues as well for us, please?
So I'm sorry, what do you mean by...
As I recall, the last time you and I spoke when you were in Sacramento, you talked about how hard it was to remember things, real things in your everyday life. It was hard to kind of get back to being normal, the nightmares notwithstanding.
Yeah, I think, I'm trying to recall some of this. It was very difficult to look at my life before being sick versus after being sick. I think for a long time I was defined by that illness. I think I mentioned the panic attacks. Being able to simply remember things that happened before the illness were difficult for me. Being able just to carry on at work was, for the longest time, was extremely difficult. I know you asked besides the nightmares are just so prevalent and powerful. And even when they didn't occur, I could not function with any level of stress. And we were in the real estate development field, and if you remember, the recession was pretty ridiculous, so we were dealing with a lot of stress. But I would constantly go into panic attacks. I'd have trouble breathing. In fact, Dr. Liu prescribed a battery-operated pulse ox indicator so I could prove to myself that, I had enough oxygen in my lungs, because I would literally feel like I was back in that hospital again. I did have, for the longest time, and still do have some trouble, like I indicated. I'll write something out, but it isn't, when I read it, it isn't what I wrote. It's hard to describe most of the other things. That's most of it. It's just functioning in the real world was extremely difficult. It was, I just didn't feel like I belonged anymore. And like I said, instead of feeling like I should smell the roses and feel like I had a second chance, there were just so many days where it just didn't seem like it was worthwhile.
Any other questions for Anthony? There's one more coming up.
Thank you for sharing your story. We had a patient very similar to you, a story very similar, about the same time, and he was in our ICU for about 4 months, and very touch and go as well. So from the nurse's perspective, I can tell you, we were there every day with him and his wife, and we actually formed a relationship with her. My question to him was, before he did leave, as they were rolling him out of the out of the hospital in the wheelchair, I said, "What did you experience?" And very briefly, he told me something very similar to your experience, that he had several nightmares throughout his stay, and one of them was floating face down, and then being tortured by people. My question to you is, at what point did you start remembering the care that you received after going in? Did you wake up at some point in time while they were rehabbing you, or at what point in time did you start remembering, or did you?
Yeah, it's kind of yes and no. I'll give you one more example of what happened while I was in the hospital and out, and then I'll talk about what happened after I started to wake up. There were a few nights it was so bad that that my family could only come in for a few minutes at a time, and I was alone. So they said to my son, "Does your dad like music?" And he said, "Oh yeah, my dad's a big Bruce Springsteen fan." So the doctor said, "Well, go get his iPod and bring it." So I guess one night they put my earphones in, and the iPod was playing. My whole Bruce Springsteen collection was rolling, which probably could have lasted 22 days. That really doesn't mean anything, except one of my nightmares was being on a Caribbean island in a old dilapidated building on a cliff that was an old slaughterhouse. And it was where people took their families to be euthanized when they were sick. And we were strung up on hooks, and we went through this building to the end where you were given an injection and put to sleep. The guy next to me was Bruce Springsteen. That has nothing to do with your question, but it has something to do with what happened. You know, people ask, "Did you know?" Well, yeah, I will say this. I knew, like I told you, a lot of that time I knew I was in a hospital bed. And when I did come to, some of the nurses, miraculously, I did know who they were. They'd walk in and I would say, "Oh, that's this one, that's..." But I also know I was awake on New Year's Eve. And New Year's Eve night, my son came to stay with me. And I had the strangest remembrances of that night. I remember a respiratory therapist coming and saying, "Well, let's rip out the trach tube and see what happens." I remember being gathered in a room full of other patients, and we're watching Mr. Ed on television. Well, none of that stuff happened. But I also do remember some of the real things that occurred. So I think, the week after that, I did get to meet a lot of people, and I do remember, the care that I got at that time. But the 22 days, no. What I do remember is my daughter kept a journal during that time. She wrote down a lot of the medical stuff, and she wrote down, just some of the things that happened. And months later, when I read that journal, that was really the first time I realized how much had gone into keeping me alive. And it's really the first time I understood how bad I was. But now we've gone back to that hospital. We go back a lot. Not as much as we should. And I'll tell you what, we've developed some relationships with people there that we'll never forget. I'll tell you how bad it is. We've actually had to go into the emergency room a couple times for some minor things. I cut myself once, and my wife had kidney stones, and we joke about this. When you go to the ICU, when you go to the emergency room and the nurses hug you, you've been there too much.
No, I don't think that's ever enough. From the nurse's perspective, we like to see you come back. So I'm sure they appreciate you coming back and following up.
Thank you.
Thank you.